Hello viewers, myself Dr. Abhilash, consultant laparoscopic surgeon from Himagiri Hospitals, Gachibowli, Hyderabad. In all our previous videos, we have discussed the advantages of laparoscopic surgery over open surgery in terms of no cuts, no stitches, less blood loss, less pain, early return to work, lesser hospital stay and all. In this video, with a small demo, we are going to demonstrate the advances in the surgical techniques over years, like how earlier in the older days after a open surgery, how we used to close the abdomen, and how the technology has advanced to such a stage that we don't have to place any stitches or we don't have to place any larger incisions over the abdomen. So let's dive into the video. So let's assume this pink color sponge as the abdomen of the patient. Like, we do have many layers in the abdomen. Like, superficially we do have the skin, and underneath the skin we do have the fat. Underneath the fat we do have the muscle, and underneath the muscle there will be intestines. Suppose if a patient requires some surgery on the intestine or some hernia surgery or uterus surgery or gallbladder surgery, what happens generally in an open surgery? Assume this as the patient's abdomen. With a knife, a large incision will be made on the patient's abdomen in an open surgery, and to close these layers of the abdomen, we will be using stitches or sutures, right? How in olden days what we used to do, with the help of large needles with a very thick suture material, like as shown here, we may have to close the patient's abdomen in this way. Like, we do approximate the right side and left side of the skin together, and we need to place the sutures as shown in this video, like this. In this way we will be able to close the gap as shown with this sutures. We will be able to approximate and close the gap in the skin. This used to be the traditional way, and if you look at the size of the needles also, as the science and technology got more and more advances, the size of the needle also decreased, and the width or diameter of the suture material also has come down as days progress. So this was the conventional way of closure in olden days after open surgery over the abdomen. And once the wound has completely healed, and to make sure that the wound is healing properly, the patient needs to have frequent regular dressings so that this wound doesn't get infected. And once the wound gets completely healed up, then the patient has to return to the doctor or clinic for suture removal, where these stitches will be cut and removed. So as the technology advanced, the sizes of the needle and the thickness of the suture material also has come down, and the size or thickness of the needle will be decided as per the length of the incision or as per the requirement by the surgeon. But as technology has advanced, there is no need for such sutures for closing the skin. Then how the skin will be closed is through the next advance called as a surgical skin stapler. How it differs? Just now you have seen that the time taken for closure at one point was much enough. So to avoid that skin lag or to avoid these sutures, the technology has advanced to such extent that we do have a skin stapler, where to close this skin we may not take much of the time, and just with a single tap of this skin stapler, if you keenly observe, we can notice a metal clip just like the conventionally used normal paper stapler. Just like this, that we do have a skin stapler to approximate the right side and left side of the skin. So this was the suture, and this is the metallic skin stapler. Both these need to be removed in the follow-up once the wound is completely healed. Whereas what we offer at Himagiri hospitals, especially if the patient undergoes a laparoscopic surgery, because the length of the incision is very small in laparoscopic surgery, we don't be needing any these stitches or skin staplers as such. The size of the incision is small, so not much tough material is required to hold the edges of the skin together. So what we do for patients undergoing laparoscopic surgery at our center is, what we offer at Himagiri hospitals for patients undergoing laparoscopic surgery is something called as a skin glue. It's just like Fevicol for the skin closure. So this will be the pack, one-time use pack, where we do have some liquid in this vial which will be loaded in this syringe, and we will be just applying this skin glue to approximate this edges of the skin, thereby avoiding the need for any stitches or skin staplers. So immediately after going home, there won't be any need for further dressings, or there is no need to avoid bathing and keeping dressings as such. Patient can go home the very next day and can have a proper bath, because there won't be any need for dressings and there won't be any need for stitches or suture removal in the future. If a patient has undergone any surgery through an open approach, the length of the incision will be big enough so that to close both the edges of the cut skin edges together, we need tougher materials like this sutures, or will be needing this skin staplers. Whereas unlike in open surgery, if a patient gets a laparoscopic surgery, there won't be any big stitches. The maximum length of the incision that the patient will be having in their body is only 1 centimeter. Because the length of the incision is very small, we need not have tougher materials to hold the edges together. In such cases, patient can have the benefit of closure without any sutures or without any skin stapler, with this thing called as a skin glue. Just by placing this skin glue to approximate the edges, it will hold the edges together, thereby avoiding the need of sutures or skin staplers, and indirectly it avoids the need for post-operative dressings or post-operative visits to the hospital or clinic for suture removal or the skin stapler removal. And added to it, cosmetically, there won't be any stitches, so the healing also will be the best when the patient undergoes a laparoscopic surgery. And to add to the cosmetic benefit, if something called as skin glue is applied, the cosmetic results will be the best. And all these treatment facilities are available at our Himagiri Hospital, Gachibowli, Hyderabad. Thank you.